If a hair transplant places new follicles immediately, why does the visible result take an entire year to materialize? The answer lies in a cellular timeline your scalp follows after surgery, and understanding it changes how you read every stage of recovery. Let's walk through the first 12 months. Biology first. In the days right after surgery, the scalp responds to surgical trauma the way any tissue does, with inflammation. Redness and swelling aren't complications, they're the delivery system. Blood flow increases to carry immune cells and nutrients into the recipient zone, kick-starting wound repair. By weeks 2 to 6, most transplanted hairs shed. This surprises many patients, but it's expected. The follicle redirects its energy away from producing the shaft and toward rebuilding its root structure in the new location. The hair falls out, the follicle stays. From Dr. Kaima's perspective on this phase, setting expectations before surgery is half the clinical work. Patients who understand that shedding is biology, not failure, recover with far less anxiety. Now the science underneath. Each follicular unit must establish a new microvascular supply, a process called angiogenesis, before it can grow again. During months 1 to 3, follicles sit in a synchronized resting phase, the telogen phase, while capillaries reconnect around the graft. Only once that supply is secure do follicles switch into the anagen phase, actively synthesizing new keratin and producing visible shafts, typically from months 4 onward. In his clinical approach, Dr. Kaima's emphasizes that no technique, Sapphire FUE or DHI, can skip this biology. What careful handling and planning influence is how many follicles survive to reach the growth phase, not how fast the timeline runs. Let's bust a common myth. Shedding means the transplant failed. In reality, shedding is a standard biological expectation of the procedure. Another myth, redness at week 2 signals infection. Persistent spreading redness with pain deserves evaluation, but ordinary pinkness can linger for weeks as the skin remodels. And density, judged at month 4, premature. Shaft thickness and final density mature gradually, often approaching their final form around the 12-month mark. Dr. Kaima's planning philosophy applies to recovery too. The surgeon's role ends at placement, but the follicle's work begins there, and patience is part of the treatment. The takeaway is simple. A hair transplant delivers follicles on day 1, but hair is grown by biology over 12 months. Shedding, resting, then regrowth, that sequence isn't a setback, it's the plan written into your physiology.